Good morning. It's really beautiful to be out here. I'm sitting here thinking that the last thing I want to do is to go back and get chained to my desk in Lower Manhattan where there's no air and there's big buildings, and rather go and maybe walk down by the ferry terminal and stay here all afternoon. I really appreciate hearing your thoughts, your words, your voices on the issues that you're struggling here in Staten Island. You have amazing representatives in senior positions on our advisory councils. Euphemia and Ken and Angela and Linda are all terrific representatives of your needs. They lend their voices to the overarching issues that face people with mental illnesses here in New York City, and they are incredibly articulate about the specific issues facing people in Staten Island. There are a few things I wanted to comment on today, but as I was sitting here listening to you all, I was thinking that probably the most important and necessary thing for me to reflect on is how important your voices are. There's not that many opportunities that even I have in my job. I'm the Assistant Commissioner for Mental Health, but there's not that many opportunities that I have to hear the voices of consumers and families. And if you think about it, that's my whole job, then there's probably even fewer opportunities for the elected officials who are here today and the people who work for them. And if nothing else, I want to encourage you to keep talking and keep writing louder and louder and more frequently, because that's what's really going to make changes. With me, you're kind of preaching to the choir a little bit. But with those folks who are out there and with your eloquence, I think you can really make change. I also want to thank Larry and all the other Staten Island Mental Health Council folks who put this together today. It's really wonderful. I think that there are a couple bright lights for our future, things to think about, and I have to echo what other folks have said here this morning about desperate economic times. It's grim, but grim doesn't necessarily mean that it's without hope. You guys are very good examples of that hope. And one of the things I think that gives us hope is employment. You heard a lot about employment today. I'm really happy to be talking about employment with you and hearing some of the ideas you have. That's what the value of the advisory council. But I also wanted to say, and Larry talked about PROS, the Personalized Recovery-Oriented Services, the new license that the state has, that there hasn't been an application for a PROS license in Staten Island. We are very optimistic, increasingly so every day, about how the PROS model will support employment and support individuals' recovery, and would love to see an application for a license here in Staten Island. So I want to put a bug in your ear about that, and that is being one of the components of helping us move our employment agenda forward. The other thing I want to talk about really briefly is that Larry also mentioned the clinic restructuring and the need to make sure that there are funds still coming into the mental health system. The department has been a very strong advocate with the State Office of Mental Health for adequate reimbursement for clinic services. One of the big things on the table right now, and I'm sorry that our elected officials aren't here any longer, but one of the big things on the table right now is a proposal from the governor to make sure that Medicaid managed care companies pay an adequate rate to clinics. This is important legislation. It's sitting out there. It's part of the budget proposal. And if your electeds could hear your voices on that, that would be really important as well. Lastly, I want to say something about housing, right? How could I not? And I certainly can't say anything as articulate as what's already been said today, but I'm not telling you anything you don't already know. People with mental illnesses are us. There are loved ones, there are families, there are co-workers, and we have to figure out ways of telling our neighbors about what that means for folks. That it means that people with a mental illness are far more likely to be victims of a crime than to be perpetrators, that people with serious mental illnesses die decades earlier than other individuals, and remind people that Staten Island is a community that rallies around people in need. We've seen it over and over. I mean, the big shining example is 9/11, but it's a community that rallies around people in need. And supportive housing is a proven way to show the support for people who really need services. One of the reasons I came to government is because it's really hard. It's really hard to do, to make things happen, to get things moving, and I like a puzzle. You know, I like it when things are really hard, and I just hate being told no. You can ask my boss later about how much I hate being told no. And so I'm committed to working with you on this housing issue. I think, you know, maybe there's another way around this. I don't think that we've maybe examined all our opportunities yet. I think there might be ways to do this. And we at the department are committed to exploring those opportunities, both for housing and for other services. Thank you very much for this morning. It's a pleasure to be here with all of you.